Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Hi.
Hello, good morning.
Just a little precursor. I'm having a nervous system shaking response right now. My symptoms are kind of high, but I really want to talk to you, so you might hear that in me. I'm on day 4 after a concussion. I've been working with you for 2 years. I had a severe concussion in March of 2023, and I've been working the program diligently for 2 years. So you've been integral to my life and my recovery, so thank you. I really got to, I lost all function in my life, other than parenting my kids, really. But I got to a functional place. I'm really on the vestibular visual. I've got my syntonics light therapy I was doing, worked with Melinda's work. It worked, I'm doing it. So on Sunday I fell. Let me get to my question. I watched Dr. Marshall's video on what if you've been concussed. My boyfriend and I were like, cool, let's do this. We just went down the list. Got the CT scan. I saw my providers. Like, I got a team here, right? So I guess my questions, and good news I know is it's not cumulative. So, and because of the 2 years of work I've done, I'm not losing my cognition. I feel very cognitively present. What I'm noticing is this shaky autonomic nervous system. It might just be still the shock of the fall coming out. My questions were, as I'm trying to assess here at day 4, or maybe I'm day 5, it was Sunday, right? So I'm trying to assess kind of what's my baseline, where am I? I'm noticing that I seem good, I'm good, I can talk to you, I'm cognitively functioning, I'm good, I got my 25 minutes, I'm cool. And then bam, my symptoms like spike to like a 12 out of 10. And I'm like, my head is heavy and I'm shaking. So I wanted to talk to you a little bit about that. As far as like with my assessment, I'm noticing I seem really good. And then bam. And also, Dr. Herkel, I wanted to talk to you about waking up sucks. Like, I've worked so hard on my sleep hygiene. I've never got my HRV up too high, but waking up from sleep to conscious, like beta, is really painful, like really symptomatic. So I wanted to talk to you about that. And like, kind of give me, where do I start right now, guys? Because I feel like now that I have all this information, I'm like, shit, where do I start now?
I think, Melinda, this is a great place for you to start.
Sure, absolutely. Well, it sounds like this just happened, right? So I love that you're already on it, right? You're here, you're asking us questions, you're trying to create a plan for yourself. And that's all great, but it could still be a little bit early. It might just be this sense of, okay, let me take a breath, right? Sometimes if we get a second concussion, you said it's been 2 years since your first one, you did really well and you had recovered pretty well, would you say? How would you say things were before this occurrence on Sunday?
Really good. I'm still cleaning up my vision. I was working with visual therapy and neck rehab. I'm kind of at the end. I feel like I was fully functioning cognitively and doing really well, actually.
Yeah.
So that's, I think, why I'm so upset.
Absolutely, right? It's a real shock to your system having another injury, especially when you've worked so hard for 2 years to sort of get back to this place of functioning. And you might just be having that nervous system response, right? That sense of anxiety coming up to say, oh my gosh, is this going to create a setback? So part of it, of course, not all of it, and I know Dr. Cam and Dr. Paul will have lots to say too, but part of it is that sense of quelling the anxiety around, oh no, this is a setback, right? We can get into this catastrophic thinking of, everything's going to go back to the way it was. Am I going to lose my progress? You might notice running thoughts like that. If I'm not mistaken, those can be pretty common, or something similar. And so it might just be, how can I take care of myself right now just to support this acute phase post, another hit to the head or a fall? Um, I would give yourself at least 2 weeks of just, doing the basics, which I'll leave Dr. Cam to talk to you about. Walking might be one of the suggestions, and just staying moving without kind of retreating completely. But from a mental health perspective, giving yourself a break, right? Letting yourself off the hook. Give yourself at least a couple weeks just to heal and do the bare minimum to sort of support the progress you've already made, but also take care of yourself following an injury, a new injury. So I wouldn't worry too much about everything's going to unravel and I'm going to go back and lose my progress at this moment, right? Let's talk about that in 2 months' time if you're still struggling. But 4 days out, it might be more of the sense of, how can I best take care of myself to support the anxiety and nervous system response that's happening? Maybe that's slow walks, deep breaths, just enjoying time with your family the best you can. I mean, I'm not 100% sure what symptoms you're experiencing right now. It sounds like they can come on really, really strongly. So it may be that sense of, am I moving too fast for where I'm at? Can I give myself a couple weeks of coasting and doing, some bare minimum recommendations that, maybe I'll turn it over to Dr. Cam to provide that to you with now.
Yeah, I kind of agree with what you're saying, is that, we always talk about these types of setbacks, right? And really what it is our response to it that determines how long it's going to last and how bad it's going to be. So if you are in this particular situation, everything was going well, you get another concussion, and you start to kind of panic about it, that's what's going to keep pulling you down and down and down, right? Like the example I use in the past has been the stock market, right? Like generally the stock market is up and to the right, but every once in a while we have these little crashes that happen, right? And sometimes they're just a 10% crash, but sometimes they end up in like a 30-40% crash. And the difference is when people start to panic and they all start to sell, and then it goes down further. So it's like, hey, you may be dealing with a 10% crash right now, but your response to that crash, whether you're going to panic sell or you're going to just be like, okay, I'm just going to let myself stabilize and then I can start building up again. Right. So if we have that resistance and we're no, I work so hard and oh my God. And now you're that resistance, it's what's going to keep things dropping. And then it takes longer to kind of dig yourself out of that. So like Melinda said, if you can just kind of take some time to chill, let all that stuff stabilize, and then you can reevaluate where you're at. In the meantime, yes, go outside, get some, decent, just light exercise, just go on walks regularly, double down on things like the diet, work on, breathing and diaphragmatic activation, because it sounds like you're kind of going into fight or flight. And if you can do things to just calm the nervous system, try to like suppress that kind of shaking response and just breathe through it, and just, you'll find that kind of stabilization point. And then from there, you can start building, right? So don't try to be building now because you're just not there yet. You have to kind of let things calm down first, and then you can build on top. And if you're trying to kind of optimize everything right now, it's probably just going to create more stress on your system to pull you down. So I would say
That's
just
the irony of it, right?
exactly.
That's that irony of it,
It's
is you
Yeah.
quicksand,
want
right?
to do.
It's quicksand, right? The more
Yeah,
you struggle, the more you sink.
yeah,
So you just need
100%.
to kind of chill and let things stabilize, and then you can reevaluate and say, okay, here's where I'm at. But in the
Yeah.
meantime, little things you can do, it's really just calming that nervous system, right? It's have a nap if you need to, go on a walk, make sure you're, just eating really clean, nothing, like avoiding the refined sugars and the carbohydrates and all that. And then working on just like light breathing exercises. And if you can, get some mindfulness in, you might be a little bit too dysregulated for that at this point. I'm not sure. But really just trying to kind of embrace and not resist and not clamor to get yourself out of the quicksand right now, because it's just going to make things worse. So just try to and
I appreciate that. So I'm already regulated since the call. So what I'm noticing is my regulation time is much shorter. So I think when I started talking, I was in the symptom spike, and they come on really quick because when I jumped on the call, zero. Like then while I was talking, high, and now I'm regulated again. Just listening to you breathing. I do breath work every day. I meditate every day, twice a day. Like I'm in my program. So I guess, yes, my mantra is calm the F down, right, from your video. My boyfriend loved that. Calm the F down. This is okay. And I have that mental processing to be able to see that and feel that. I think what's happening is what you're describing is that fight or flight is part of the symptom picture right now.
Mhm.
So kind of everything goes with it. My thinking, my
Right.
shaking, right? That is part of the symptom picture. So, I guess what I'm hearing, since I understand cognitively, my body, it's like a limbic system autonomic fire that's happening. So because of that, is kind of like the main driver symptom, and then it goes physiological. I've cleaned up my food, Dr. Herkel, immediately, boom, because I got a little lazy, I'll have to say. It's cleaned up. So Dr. Melinda, do you think going into the mindset work right now and kind of dialing that up, because that seems to be where this is triggering?
Mhm. Yeah, you might just normalize that nervous system response following an injury, right? It's
Yeah.
natural to go into that fight or flight because the
Okay.
purpose of it is to try to protect you. But the irony of it, or the paradox of concussion a lot of the times, is that the more we listen to that response, the less likely we are to keep moving and doing the things that can help us recover. So validating that fight or flight response coming up, or that limbic alarm bell that's showing up for you when you
Mhm.
get symptoms, and just reminding yourself to take it slow and easy, right? Movement, gentle moves, even walking. Like walking is so wonderful just to regulate our nervous system. Get outside, just breathe while you walk, feel your feet against the ground. Even if it doesn't feel like you can maybe meditate right now, it sounds like you're still doing that, which is great, if it's working for you. But some people, commonly people will say to me, I can't meditate following a re-injury just because everything's so heightened. That's okay. Start slow. Move, breathe, focus on sleep, rest, continuing to include some joyful activities. These are just the basics to sort of help remind your system that you're safe, right? You had a bump in the road, but it doesn't mean that that alarm bell has to be sounding all day long. It's just constantly sending those signals to your brain, to your mind, and your body that that was a temporary thing that happened and that it's not going to happen again, right? That you're going to be able to regulate again. So taking it slow and easy, not feeling the pressure to kind of get on all the things that are going to make you better, at least not now, right? Let's have that conversation in a month.
Right. I think that's where, when I saw 2 to 5 days, start assessing, get on the train, right? Like, right, let's do it. I'm not wasting any time here. I'm building a life again. Like, I don't want to, right? So I think that's my main takeaway right now is like, okay, even though it says 2 to 5 days, get on the train, reassess, really like, okay, maybe my nervous system just needs a little more baseline.
Yeah.
Slow it down this first week, maybe even next week. Clear the calendar,
Mhm.
chill,
nothing
do the
wrong with that.
basics, let
Nothing.
myself come out of the fight or flight because clearly I was shocked. And then all of what I've learned is just going to drop into place again. And I do want to, I think I can just stay in touch. I'm in the group, right? I'm in your program. I'll just stay in touch. As more
Mhm.
specifics come up, I can ask them then. And just right now, like, just remind myself, okay, maybe day 2 to 5 for me needs to be more like a little, like, just stretch that out a little bit.
Mhm.
Um,
Absolutely.
Yeah. So I have two things to say. One, it was interesting kind of how you said, like, when I came on the call, 0, but right when I was speaking, shot way up. And then now
yeah.
listening to you guys, it calms down, right? So that just seems like that's an anxiety or stress response. Now it's, oh my God, it's my turn to talk. and I'm overwhelmed. I have a lot of things I want to ask. I want to make sure that I convey it well and all these things. So then that just heightens up, right? So that just shows you where the nervous system goes, because it goes into that like, fight or flight. And that's where the symptoms seem to be triggered from. So if we can try to do things just to kind of let things calm down and do that breathing. Now, here's the good news, right? If you were net new, never had a concussion before, the average person takes 10 to 14 days for the symptoms to go away anyway. Right? So you're on day 5. So I wouldn't start panicking that the symptoms are still present, right? You're still well within the window of normal. And what we also find from people in this program that have already done the work and already know the strategies, it does go a lot faster because you've already done a lot of the groundwork for it. You already have that kind of base. You already have that knowledge. So it's just now trying to kind of reassure yourself that this is going to be very temporary. This is not setting you back 2 years where you have to start all over again, right? It's just, you just got to wait till things kind of normalize a little bit, do the foundational stuff. You might as well, because all that stuff is going to be helpful. But if you can, really internalize what we're saying, that this is a short-term thing, this is not going to be a long-term thing, I think that'll help to just kind of stabilize you where you can start to build back up again. And I think before you know it, you'll be like, oh shit, I feel pretty good.
Yeah, got it. I love that. 14 days, I'll come in with questions like, let's see after the normal window, let's give my brain, give my body 14 days. Like, let's give it that time, do the basics, obviously. But then when I have specific questions about, waking up sucks, Dr. Hergel, tell me what's going on hormonally. Like, what do I do? Like, that question actually is almost premature as well, because I'm in that normal spaz out period, 14 days.
You're in the thick of it, right? Like, concussion injury just happened. You're in that kind of metabolic low, right? Like we hit our peak metabolic low around day 5 to day 7, and then we start building. So like, you're kind of in that sweet spot for where things tend to be kind of the worst. So just, give yourself that grace, take time. Don't just lay around and do nothing though. Like, you want to still kind of go about your day. You want to do walking and you want to do breathing. You want to do things to help yourself. But if you want to have a nap, have a nap. If you need more sleep, try to get it. That's okay. That's fine. Perfectly fine.
Yeah, you're not going to lose your progress. Yeah, I just wanted to say you're not going to lose your progress, right? I think that's the biggest fear when there's a re-injury is I'm going to lose all this progress I made to find my new normal and get back to my life following my first injury. And no, you're not going to lose your progress. You already know what that looks like and what that feels like, and you'll get back there.
I appreciate that. Thank you so much for your time. I'll be in touch in the group.
And you mentioned sleep. And so, I would even say, don't even worry about all those additional things, because right now your nervous system is really what's amped up, and you're in that fight or flight. So in the acute stages, we want to implement some of the basic things. Like, sleep hygiene is like a mindfulness type practice. So just focus on the things that Melinda and then Cam mentioned, and then after you get out of this acute kind of flare, then you can focus on, okay, I'm going to like really optimize my diet. So you're just really trying to focus on the basics to give your nervous system a chance to recover.
Thank you all so much.
You're welcome.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.